Hello, Respiratory World. This is what we call um, accordion. Accordion goes on the end of the trach to the connection to the ventilator or to maybe a T-piece for aerosol therapy. This allows a little bit more pull and push with the trach. Patients that tend to move around a lot in the bed, we want to have our accordion in place because a lot of movement of the trach can cause, scarring, edema. Uh, it can cause the tissue to tear, so active bleeding at the trach site. So this just allows a little bit more mobility for the patient that's pretty active, and we can't keep them still. When they're moving around in the bed, it won't cause as much damage to the trach if the trach moves. If we have our accordion in place, just a little bit more flexibility for the trach to be able to have some tug and pull. Not so much for the trach to have some tug and pull, but whatever the trach is attached to, the ventilator or the T-piece, for aerosol therapy. If it moves a little bit more than it usually does, it won't cause as much, bruising and, tearing around the trach site because the tracheostomy tube is directly in the trachea. So, moving, it's an open wound basically. So all that moving can cause, damage and stuff like that to the trachea. So, just to have less incidence of damages and damage to the trachea, we give the patient an accordion to have a little bit more flexibility. We don't want the patient moving around in the bed, but that tends to happen. Patients are active and trying to get out the bed, so accordion.